everybody who's on this Zoom meeting, welcome. Dr. Gordon will lay out some quote-unquote rules he has during this his presentation. For those who are not familiar with Dr. Gordon, he's one of the physicians in Colorado that is well educated on the use of medical cannabis and everything that has to do with it. That is the reason why we invited him to do this talk. If you'd like to know more about the way he practices, where he practices, you see his website on this first screen, and it will also be in, or it was also on the email that you received, and it will also be on the recording that we also of this presentation that we will also send to you. So, welcome again, Dr. Gordon, and yours is the stage. Thank you.
Excellent. Well, thank you, Stefan, and thanks to the whole team at Colorado Spine Therapy for putting these on. It's really time for cannabis to get the reintroduction it deserves. People have been finding value within this plant for thousands of years, and I'm honored to have this opportunity and many others to teach people about cannabis and its potential therapeutic value. Unfortunately, in politics and in the medical arenas, really all discussions about cannabis seem to start with just this false assumption that cannabis is evil and dangerous, and we should fear it. And even with legalization, that's kind of still the message that gets disseminated from politics and medical space. And really, this is just residual from the 100 years of false propaganda that we need to break from. And when there's this false assumption, really the consumer or the patient suffers because there's not quality education out there. But of course, now we have legalization in many states, and we have this huge commercial industry growing. And now once money becomes the focus, we kind of have a new set of false claims that come alongside with mass production and marketing. So in this new corporate model, the priority and needs of the consumer and the patient can also suffer. And I believe cannabis has a huge amount of value to offer us. Medicine is really just one part of that, and I believe it should be accessible to all of us. So therefore, it becomes my responsibility and really our responsibility to educate people properly so we can incorporate it safely and effectively for those who choose to consume it. Now, throughout this talk, I'm going to give out a lot of information. Some of it may get a little confusing at times, but there's going to be plenty of time for questions at the end. Since it's a small number with us here live this morning, if you need to interrupt me, feel free to do so. But again, there's going to be plenty of time for questions at the end as well, and I'll have some resources for additional learning and support for you also. I suspect for many of you here, and certainly for many in the community that's being reintroduced or introduced to cannabis, the primary reason is as a medicine. The use of cannabis as a medicine has really led the way for this increasing legalization surge and the increasing access and consumption in the United States and throughout the world. And really just pause for a minute, we owe a deep debt of gratitude to those that fought for years to make this happen, commonly at the expense of their own lives and their own well-being. Again, cannabis prohibition has had a deep wound on many communities, many individuals. And so, again, just want to acknowledge everybody who fought over the last 25 years, especially to make cannabis accessible now to the greater population. If the current standard of care worked really well, there wouldn't be that much interest in medical cannabis. But sadly, the options we typically give people for chronic disease, which really is just medications, procedures, surgeries, these options for chronic disease and certainly for chronic pain, they're commonly ineffective and often quite dangerous. Now, don't get me wrong, these are valuable tools for practitioners. We certainly want medications and procedures, surgeries in our arsenal of treatment options, but they're highly overutilized, especially as first-line therapy. And there's a wealth of integrative approaches cannabis included, that are helping people, and the greater community really deserves to have access and education about these. You know, we have a chronic disease epidemic in this country. People are struggling. They just want to feel better. And I wish I could say that cannabis is the answer to all of that. It's certainly not. It's not a magic bullet, but it can really be a valuable tool in our approach and treatment methods for chronic disease. Carl Sagan once said, cannabis helps produce the serenity and insight, sensitivity and fellowship so desperately needed in this increasingly mad and dangerous world. And he was a longtime cannabis consumer. And of course, there are some compounds in cannabis that are psychoactive. They change perception. They allow us to look and see things about our lives and the lives of others that might otherwise be hidden. They can foster creativity, help us look outside the box, and simply allow for heightened sensation and pleasure. And so a lot of people label these aspects as just recreational cannabis. I think that's oversimplified, not really accurate, because wisdom and perspective, increased connection and enjoyment, these really play a huge role in optimizing health. And so as we go for this talk, I want you to keep an open mind about why you're interested in cannabis consumption. Labels like medical cannabis and recreational cannabis have value, but they don't really tell the whole story. And they often mean different things to different people, so it's hard to generalize. So briefly, I just want to summarize how I think about this. So we have these terms, medical cannabis and recreational cannabis. And medical cannabis generally is, the primary goal is someone looking to treat a specific symptom or a condition. But again, that can mean a lot of different things. On one extreme, where there's no real overlap with recreational cannabis, it's just someone taking a specific product. Any potential for intoxication or impairment is completely avoided because it's looked at through the lens of prohibition. And you just take a specific medicine, essentially no different than a pharmaceutical, and you take it on a schedule. You kind of hope it works, and that's it. This is very reductionist, not really personalized. You know, on the other side, you have recreational cannabis, and there the primary goal is impairment or intoxication. And again, on this extreme where there's no overlap with medical cannabis, it's just someone using a lot of high THC cannabis without any awareness or really any intention, and it's just getting as intoxicated as possible, as frequently as possible. And again, that method is where we see some of the potential downsides and more of the side effects with cannabis consumption. But personally, I think the most effective place is somewhere in the middle, and what I call intentional cannabis. And intentional cannabis can have a recreational component. There could be a psychoactive component, but there's still a reason, there's still a purpose, there's still an intention for that intoxication. Maybe you're treating a specific condition, but there's still not just pure pharmaceutical approach to it. You're using intention, you're making adjustments, you're using different types of products. So as we go through, and we'll touch on this more, I just kind of want you to have that kind of in mindset where I'm going to focus on, generally with clients, this intentional cannabis, where there's often a huge overlap between what we might call recreational or medical, depending on the patient's needs. Real quickly, just a little background on me and how I come to be giving a talk about cannabis. I'm an internal medicine physician. I did all my training at the University of Colorado. And I opened a private practice shortly after residency, many, many years ago. In fact, I met Stefan and started working with Colorado Spine not too long after I started practice in 2003. But pretty quickly, I realized the tools I was given in training didn't work that well for patients. I would make the right diagnoses, prescribe the right medication, make the appropriate referrals, but patients really didn't get much better. And so I spent really the rest of my career looking for better ways to deal with chronic disease for patients. And that led me into the world of integrative medicine and then functional medicine, which is, more commonly described as kind of a root cause approach to chronic disease. And then in 2010, approximately, people started asking for medical cannabis certification as it became legal in Colorado. And so I had some patients that said, oh, I'm using cannabis already. Can you give me a certification so I can use it legally? Which I did. And after doing several of those, I decided, hey, I should probably know more about this. So I started doing some research on cannabis and was just blown away by how much science and knowledge there was about cannabis, the plant, cannabis, the medicine, what we call our endocannabinoid system. And all this was information that was withheld from me in my medical training. I got zero knowledge about this. So I spent a lot of time self-educating and then using cannabis more in my practice as just one of the tools for treatment. And then I closed my main practice in 2018. And since that time, I've spent far more time in the cannabis space, working with patients, doing a lot of education like this and educating practitioners as well as the general community. I'll be starting some formal teaching at the Community College of Denver, who now has a couple cannabis degree programs. So I'll be teaching a couple courses there this fall. I do work as a consultant for a few organizations that are listed there. But other than mentioning one as a resource at the end won't be pertinent to this talk. There's a lot of barriers to people getting good information about cannabis. Again, a lot of this is just due to this, prohibition era where there was a lot of misinformation and propaganda that was anti-cannabis out there. And so there's just a lot of common myths. People are talking about cannabis now as a medicine, so they think it's new. There's a lot of talk like, oh, we don't know anything about why it works or how it works, or there's no data, there's no science. You'll hear these a lot. We talk about cannabis medicine as a single entity. And hopefully by the end of this talk, you'll understand that really cannabis is not one medicine and that one product is not the same as another. So we can't generalize. People assume using cannabis means you're getting high or intoxicated all the time. And that's certainly not the case. And then on the flip side, people assume intoxication is a bad thing. Again, intoxication is just a drug user or a recreational or a substance user. And again, we'll see that intoxication can actually have some therapeutic value. So hopefully by the end of this talk, I'll have dispelled some of these myths or all of these myths. And if not, definitely something we want to talk about further. Cannabis as a medicine has been used for a very, very long time. The first written documentation is over 5,000 years ago, where cannabis was one of the staple medicines in the first Chinese pharmacopoeia. Pharmacopoeia is basically a book of treatments, of medicine treatments. And again, cannabis was one of the major treatments in the first written Chinese pharmacopoeia. Likely it was used for several thousand years even before that. And cannabis was a staple in Eastern medicine. It's one of the primary medicines in Ayurvedic medicine, which comes out of India in the Hindu culture. In ancient Greece and Rome, again, it was a staple. It was listed as a major medicine in their pharmacopoeia. And that pharmacopoeia was used for about 1,500 years throughout the Middle Ages and up into the Renaissance period. Cannabis was primarily used in the East, but then was reintroduced in Western Europe, both through Napoleon and then through an Irish physician that was working in India in the early part of the 19th century. And so Queen Victoria's doctor was a cannabis advocate. It's questionable whether she used it. Often she's reported to have used it for menstrual pain, although that's not been formally documented. And then the most interesting thing I learned and I found, so we all know this photo on the right of the physician doing house calls with their black bag. It's a staple of the late 1800s and early part of the 1900s. And I can say with certainty, there's about 100% likelihood there's a cannabis medicine in that black bag. In the early part of the 20th century, every major pharmaceutical company made cannabis medicine that was a regularly used product throughout medicine in the United States and Western Europe. So this is not new to us. It's just with prohibition, it disappeared, and prohibition started in the 20s and formally became in place in the 30s with this massive anti-cannabis propaganda campaign. So I put up this slide, potential uses for medical cannabis, and you can see it covers basically every disease. And when I put a slide like this up, really your, excuse my language, your bullshit meter should go off and be like, no, this is not possible. One medicine can't treat all these different conditions. And there is not definitive proof yet that cannabis medicines can treat all these, but there's some science suggesting it might. And so really I put this slide up to have you start questioning, well, how is it possible that cannabis could potentially treat so many different things and so many diverse conditions? And I use this slide to really introduce what we call the endocannabinoid system. So the endocannabinoid, this stands for internal cannabis system, meaning this is a cannabis system that we have in our own bodies. We make cannabis compounds ourselves. We have receptors for cannabis compounds, and we call this the endocannabinoid system. We found this scientifically by trying to figure out how THC worked, and then we learned we have this whole system ourselves that THC acts upon. And so what does this endocannabinoid system do in our body? Well, it's extremely important. Its overarching job is to create balance. So the endocannabinoid system's job is to create balance in the body. We call it homeostasis. And basically that means it tries to keep our body stable in the face of all these external triggers and circumstances. And the endocannabinoid system works at a very kind of upstream level, meaning all the other systems in the body, the cardiovascular system, the kidneys, the lungs, the GI system, the nervous system, the immune system, they all kind of sit below the endocannabinoid system. And it's the endocannabinoid system's job to kind of balance all the other systems in the body. So again, a crucial physiologic system, and so important that it's there in all animals, in fact, all vertebrates. The endocannabinoid system has been around for 600 million years on an evolutionary scale, and fairly similar throughout all vertebrate animals. So in addition to balance, we can think of the endocannabinoid system also helping regulating 5 key aspects of our life. Helps us relax, it helps get us out of fight or flight, regulate how much and how often we eat, helps regulate our sleep cycle and helps us get to sleep. It helps us forget, which initially you might think of as a bad thing, but forgetting is crucial. We have so much sensory input throughout the day, we have to forget. And if we can't forget, you see this manifest maybe in something like post-traumatic stress, where people can't forget that trauma and it cycles repeatedly. That's often caused by a defect in the endocannabinoid system, and it's one of the reasons why cannabis seems to be very effective there. And then protection, this is not protecting us from the outside world. It's not protecting us from things like viruses or whatnot. This is protecting us from ourselves, protecting us from our own immune system, damaging us. And we can see this go awry in autoimmune disease and chronic inflammation, but that's part of the endocannabinoid system's job, is to quiet our immune system down. So again, we have this powerful endocannabinoid system, again, that has chemicals and receptors that do all these important features. And then cannabis evolved as a plant, and cannabis happens to make chemicals that bind to the very same set of receptors that our own cannabinoids bind to. So the medicines in cannabis, THC specifically, kind of activate our endocannabinoid system just like our own molecules do. And then other compounds in cannabis work through this endocannabinoid system as well. So you could see where we have this very powerful endocannabinoid system that helps balance the whole body. When medicines in cannabis work through that system, you could see why it could treat so many different conditions, because it's working at a very upstream level. We talk about cannabis as a medicine, and I said that that's not really a sufficient way to talk about cannabis, because cannabis isn't one medicine. In fact, cannabis is just a plant, but it contains over 400 different compounds. So as opposed to a single medicine like ibuprofen or lisinopril or Percocet, whatever it is, those are single molecules. They work in a very specific way. Cannabis has hundreds of molecules in it, so there's no one cannabis medicine. We have different constituents. We have what are called cannabinoids. These are compounds that are generally only found in cannabis plants. And these are the molecules you're probably most familiar with, things like THC and CBD. We also have this alphabet soup of other cannabinoids, which we're learning more about and utilizing more. We also have terpenes, which provide the flavor and the smell of the plant that also have their own therapeutic properties. Anyone who's used essential oils, it's the terpenes that are the therapeutic compounds in essential oils. And then there's other antioxidants and flavonoids, things that, again, provide value and benefit. So just a reminder that we have multiple constituents in cannabis, and it's how we combine them and which of these constituents are in the final product is really what's important, not generalizing just cannabis as a single medicine. I want to clear up a little terminology because I suspect there usually are questions about that. So I use the term cannabis, but you're also going to hear the terms hemp and marijuana out there in products and in the community. So I want to just touch base quickly on kind of what those terms mean, and at least what they mean to me. There's still some debate, but this is a pretty universally, common nomenclature. Everything is cannabis. Cannabis is just a plant. That's the name of the plant. Cannabis sativa, L officially is the name of the plant. So everything is cannabis, but just like dogs, where you have different breeds that look differently, act differently, behave differently, you have different, essentially, types of cannabis that will act differently, look differently, behave differently, make different types of chemicals. And so hemp and marijuana are simply two different types of cannabis, and they're not really that different botanically, but it's more of a legal definition. So when you look at the various compounds in a cannabis plant, THC, which we'll talk about more, is one specific compound. And if that plant naturally has a very low amount of THC, less than 0.3% to be exact, the US government labels that as hemp. So hemp is just low THC cannabis. If the cannabis plant has above that 0.3%, it's labeled as marijuana. And hemp and marijuana, the difference really is more their regulation. Low THC cannabis or hemp cannabis essentially has no regulation. Virtually anybody can grow it, anybody can sell it. So all the products that you see in grocery stores and health food stores and online and in gas stations, those are all hemp cannabis products grown from this low THC cannabis. This low THC cannabis does have a lot of another chemical called CBD. And so again, a lot of the mass-produced CBD products come from this hemp cannabis. But again, there's no regulation in the hemp cannabis space, so there are some challenges there. Once you have more THC above that 0.3%, it's regulated as marijuana, and that's where you have dispensaries in only states that have passed various either medical or recreational use legislation are allowed to sell that higher THC cannabis. So just remember, it's all cannabis. Hemp is naturally low in THC. Marijuana is naturally higher in THC. One is not better than the other. It's really more which compounds are you looking to utilize. The big difference, and we'll talk about this in the safety section, is how it's regulated. So I mentioned there's all these different compounds in cannabis. We tend to focus primarily on two of them, THC and CBD, and I'll go into those in a little bit more detail. But there are other important compounds. The other cannabinoids, which we call the minor cannabinoids, are important. The terpenes, the flavonoids, those are also important. And so what we tend to find, the research supports this, and generally we see this clinically as well, is that cannabis medicines work best when you use a combination of the different constituents. You could certainly give 100% pure CBD or 100% pure THC, and they'll have some therapeutic value, but typically people don't do as well and tend to have more side effects with just 100% of a pure chemical. They tend to do better when we use a combination of CBD and THC, especially with these other constituents as well. And we call this the entourage effect, meaning that the sum of the parts is greater, or the effect of the parts is greater than just their sum. And so when we talk about products, often I'll almost always be using, again, a combination of THC and CBD, and especially products that also contain these minor cannabinoids, terpenes, flavonoids. Often the term full spectrum is used to describe this, where you have as much of the residual plant in that end product. And so that's, something to think about when we get into product selection. But again, THC and CBD are our two main cannabinoids. That's typically how products are labeled. And that's typically how we talk about dosing of cannabis therapies. So just to really go over those two compounds a little bit more, THC is the compound in cannabis that most mimics our own endocannabinoids. So THC binds to our two main cannabis receptors in the body. It mimics that homeostasis effect. It helps mimic those effects of relax, eat, sleep, forget, and protect. And it's this action that makes THC, in my opinion, the most important therapeutic compound in the plant. And so I think really THC should be part of any cannabis regimen. That being said, THC is valuable at a low dose. You do not have to be intoxicated or impaired when using THC. So again, low dosage of THC are therapeutically valuable. So just because someone's using THC doesn't mean they're getting high. Again, we want to include it in our cannabis regimen, but again, often that's at low doses that don't cause any impairment, but still have therapeutic value. Now, as you increase the dose of THC, intoxication is possible, but again, intoxication is not always a bad thing. The most common description of mild intoxication is just increased pleasure and happiness. And so something that's obviously valuable for a kind of a recreational or social purpose, but it's also valuable in chronic disease, especially mental health issues and someone dealing with chronic pain where pleasure and happiness might be a struggle. So again, we can use the intoxicating effect of THC if we want to as a therapeutic, but more is not better. We'll talk about side effects and safety a little bit later. CBD acts a little differently than THC. CBD doesn't directly bind to our cannabis receptors. It kind of helps our own system work better. It helps our own internal cannabinoids work better. It also binds to a whole set of other receptors in the body, providing a variety of benefits. CBD just has a huge range of physiologic properties. I tend to think of CBD more as like a maintenance agent. You can get some immediate benefits from CBD, but I think it tends to work better when it's used more continuously. CBD can also counteract some of the side effects of THC. So having CBD and THC together allows for kind of a better safety profile and a better tolerance profile. CBD is extremely safe, very non-toxic. There's research studies using thousands of milligrams of CBD, and most of what we use in clinical practice tends to be in the tens and hundreds of milligrams. So again, we have a very wide dose range that we can use. CBD is often considered the medicine in cannabis, and THC is often considered the drug, although that's really just completely a false statement. And again, that's just kind of this propaganda that tends to look at THC or intoxication as this huge negative. CBD is an effective medicine, but so is THC. And in fact, THC has far more research behind it as a medicinal agent than CBD does, even though CBD is so popular out there. I talked about cannabis being complex because there's so many different constituents and so many different chemicals in the plant. We can complicate that further by having so many different ways we can administer cannabis. We can inhale it, we can use drops, we can use topicals, we can use powders, foods, the list goes on. If you've been into a dispensary, you've seen all these variations. And I'm not going to go through all of these, but I do want to touch on a few of the most common methods that especially kind of medicinal cannabis consumers are likely to use. The take-home point is that there's not a best method of administration. The method of administration each has their own pros and cons, and really depending on what someone's goals are, that allows how we can select an option. Topicals are a really easy entry point. There's essentially no downside to a topical outside of a rare allergic reaction. And so for folks having pain issues, it's often a place people will start. The thing to know about topicals and pain is they really only work superficially. So if you have a very deep pain issue, say like a hip arthritis, the topical is not going to penetrate down into that joint. So we really use it. I like to say if you can push on a body part and it hurts when you push, there's a decent chance a topical might have benefit. But once that problem goes deeper, topical is likely to be ineffective, and you need to get cannabis into the bloodstream and distribute it throughout the body. Not a lot of research on topicals. And what I see with patients is it works probably in about a third to a half of patients. But in those patients where it does work, it works really well. And there's a lot of patients that all they use, say for their hand arthritis or for their tendonitis, is a cannabis topical. And again, in that population where it works really well. Can be a little bit costly. So I usually just recommend people buy the smallest kind of available amount, see if it works. If it doesn't work after 2 or 3 uses, put it in the cabinet, try it for another pain issue down the road. You don't need to try it for weeks to see if it's going to work. You'll usually know pretty quickly. I put up a slide about inhalation. It's not generally how I recommend new cannabis consumers, medical cannabis consumers start, because generally we want to avoid smoking or what we call combustion. But I put this slide up just to remind people that there are safe and good options for inhalation. Vaporization and vaping has a bad name because of a variety of reasons. The nicotine vaping issues, especially in adolescents, as well as the quote vape crisis that occurred in 2019 with some low quality black market devices. But vaporizing, especially vaporizing of dried cannabis flower, dry herb, is an extremely safe and effective way. So for folks who find inhalation to be the most valuable for them and use inhalation on a regular basis, we'll often use this, what we call dry herb vaporization. Inhalation might also be effective for people who need it to work immediately. So especially if you're dealing with nausea, vomiting, low appetite, often a little bit of inhalation just before meals can be extremely effective. So it's a tool out there, but most people are going to use what we call ingestibles, especially folks with chronic pain, chronic emotional health issues, things that are really occurring day in and day out. We tend to want to use something ingested because the duration is going to last longer and we can maintain a nice level in the body. So with ingestibles, the duration can be 6 to 12 hours. And so we'll use it twice a day, 3 times a day, maybe 4 times a day, depending on someone's needs. And this is the most common way. Again, we'll use cannabis as a medicine, and especially for new consumers. Main thing to know with ingested cannabis products is that it can take up to a couple hours for its effects to kick in. So what we want to avoid is someone taking an amount and 20 minutes later going, oh, I don't notice anything, taking more, 20 minutes later going, I don't notice anything, taking more. And then all of a sudden, 2 hours later, it all kicks in and people can overconsume that way. So as long as you're aware that it can take a couple hours to kick in and not redose until you've had several hours of it having a chance to work. Safety works great. If you look in a dispensary, half the time it looks like a candy store. As an integrative doc who prides himself on nutrition being my number one way I treat patients, I really try to avoid sugar and toxic stuff in my medicine. So I really recommend folks look at kind of what I call a medically focused design, which means you can use a very low dose. It's got consistent absorption. It doesn't have sugar. And then again, it's nice. You can sometimes combine with other botanicals. So there's lots of options. Most people use either capsules or what are oil infusions, which are commonly labeled as tinctures, where we can dose even 1 drop at a time. So a nice way to start low and build the dose up slowly. So these last few slides hopefully will make this point clear. And if you take nothing else away from this talk, just remember that kind of one size does not fit all when it comes to cannabis. In my opinion, one size does not fit all when it comes to chronic disease in general. And that's part of our failure of chronic disease, is that we try to give everyone with the same diagnosis the same treatment, and that doesn't work well. I found that out in my practice. But with cannabis, that's especially true. So a lot of cannabis is finding a place to start and then making adjustments. And again, we'll talk about that a little bit more towards the end. When I'm talking to a patient about whether they want to consume cannabis for a medicinal reasons, these are the most common conditions I'll see and physicians throughout the country will see. So when you look at surveys of who's using cannabis to treat conditions, these are the most common conditions out there. We'll talk in a minute how I approach the evidence supporting these treating these conditions. But when I'm deciding whether cannabis is a safe and effective choice for a patient, I also have to consider, well, not just about cannabis, but what is this patient's alternatives if they don't want to use cannabis? And generally, the alternatives are pharmaceuticals. And for the conditions on the left, these are often the most common treatments we're using for these conditions. And as I said earlier, these medicines have value. They certainly deserve a place in our arsenal for treatment, but they are highly, highly overutilized, and the potential side effects are often just discarded or discounted, and they're just, again, overprescribed. And by some estimates, prescription medicines result in up to 3 million hospitalizations per year and over 100,000 deaths. Opioids alone, deaths are now over 75,000 a year, and the majority of patients who are dealing with opioid overdose and or death began their addiction and their opioid issues with an authorized prescription. But even other medicines, even simple things like non-steroidal anti-inflammatory drugs, things like ibuprofen, Aleve, and whatnot, those can have significant short and long-term negative health implications. So again, when I'm considering cannabis for a patient, I'm going to look at the safety and efficacy of cannabis, but really also look at the safety and efficacy of the other options. And often you'll find the standard of care is not ideal and doesn't even really have good scientific evidence pointing to its value. So after all that, does cannabis work? And I mentioned you can use cannabis to treat such a range of conditions, and there's different constituents. And so there's not going to be what we call a randomized trial for every possible disease and every possible kind of collection of cannabis constituents. So I don't have time to go through all the science and all the research, because there's really hundreds, if not thousands of trials looking at cannabis through a whole variety of different diseases. But I do want to touch on briefly how I approach science, because again, if you talk to most doctors and say, oh, what about cannabis? They'll just go, oh, there's no evidence, there's no science, and kind of poo-poo it and just say, here, take this. So I want to tell you how I think about the science, and I use what's called an evidence-based medicine approach. This term often gets used incorrectly in medicine, but true evidence-based medicine is a three-pronged method. So it starts with our current best evidence. This is all the scientific data showing how and why a medicine or a treatment like cannabis might work, and then all the clinical trials showing how it worked in various conditions and with various medicines. So we start with that, but we don't just use that, or we don't just pick one study that tells us what our opinion is and ignore everything else. Also use clinical expertise. So what I see as a clinician, what other physicians and other practitioners see, that's crucial information deciding whether we think something's going to be effective. And then we also use the patient's experience and the patient's goals and values. And so evidence-based medicine is a way to decide, when I'm sitting one-on-one with a patient, is this an appropriate therapy for that patient? So I'm not just using the science, I'm also using my clinical expertise, and I'm also looking at what's the patient's goals and values and their experience with other medicines. And so when I look at recommending cannabis, I want to look at the patient's views. I know what I've seen, but I also want to look at the science out there. One place I can look is really just see how patients have responded when given cannabis. So this is a study published this year. It's a registry of thousands of medical cannabis patients in Israel. Israel has a much more organized and structured medical cannabis program than we do. It's not just get a card and then you're on your own at a dispensary. They get education and guidance and have a more streamlined set of products. So everybody in the study was someone struggling with a chronic condition for at least a year. They were treated, they were under care by a physician. So they were getting the standard of care, whatever pharmaceuticals or procedures or whatnot, but they were still struggling. So the hardest people to treat, they were given access to cannabis medicines and education about cannabis, and then they were followed up after 6 months. Now, they used a variety of different products and methods of administration, and they had a whole range of different conditions. This is what they decided is treatment success. So treatment success was determined as at least moderate improvement in your condition and wanting to continue cannabis after 6 months. And you see such a range of conditions: cancer, pain, autism, epilepsy, bowel diseases. We mentioned cannabis can be used for a range of different conditions. And treatment was pretty successful. Almost everybody saw at least 50% improvement in these conditions. Some seen 70, 80, 90% improvement. And so again, these were people that were struggling with standard of care, given the option to use cannabis, and got better. This is the data on pain. You see at the beginning of the study in yellow, people reporting high levels of pain, and a big shift to more lower or moderate levels of pain in the blue after 6 months of cannabis therapy. Quality of life is something that's often not discussed enough or even researched in trials, but really it's arguably the most important thing. At the beginning of the study in yellow, you see most patients reporting bad or very bad quality of life. After 6 months of cannabis therapy, you now see patients reporting good or very good quality of life. So this study does not prove cannabis is an effective treatment for all these conditions. You really, to say definitive proof, you need what's called a randomized double-blind placebo-controlled trial, where half the patients get cannabis, half the patients get a fake cannabis, and you measure how they do. But again, since we're talking about so many different conditions and so many different ways you can use cannabis, you would need an infinite array of randomized controlled trials. So we use randomized controlled trials to give us a starting point, tell us what might work best, and give us a place of where to start. And we have many randomized controlled trials with cannabis. But I think big studies like this, where are more real world and real life, again, don't give us definitive proof. But as I said earlier, this is a group of thousands of patients who were struggling with chronic conditions. They were given education and access to cannabis medicine, and they did significantly better. And to me, that's pretty valuable evidence, and certainly valuable for those patients who were part of this study. I want to talk a little bit about safety for a few moments. First, because it's important. Obviously, first do no harm is one of the first things physicians learn. But I also want to talk about safety because many people are still afraid of cannabis. Again, a lot of that's attributed to this propaganda campaign of the last 100 years, but this fear of cannabis is still pretty prominent. Now, cannabis is by no means risk-free, but the dangers are often greatly exaggerated. Many of the risks that have been attributed to cannabis are associated with really heavy smoking of high THC cannabis. That is certainly common out there in the community, although not as common as you might think, but it's especially uncommon amongst those attempting to treat a symptom or a chronic condition. So a lot of the side effects and safety issues that are associated with cannabis aren't really even pertinent to the average medicinal cannabis user who's using low dose of products in an ingested form. In all the medical studies, so all the clinical trials using a variety of different cannabis medicines, as well as these big observational studies of medical cannabis, it's extremely well tolerated and very safe. And we just don't see significant side effects. We certainly see side effects, but in terms of dangerous side effects, things that put people in the hospital, things that cause organ failure, things that cause death, we've never seen. So again, when there's education about cannabis and there's guidance and access to quality products, the side effects are fairly minimal, and really the safety profile is great. But there are some things worth mentioning. So short-term impairment from THC. THC can be impairing or intoxicating. The next slide is going to go through some of those details, but some of the risks and some of the things we pay attention to are these short-term risks of just having THC intoxication. Like I said, the next slide, we'll talk about those in more detail. If we think about cardiovascular concerns, this is really specific to a small group of people, folks who have unstable coronary disease or unstable cardiac disease, recurrent chest pain, active blockages, recurrent heart attacks. Those folks are a little higher risk if you get a big blast of THC all at once. And likewise, people who have had abnormal heart rhythms, atrial fibrillation, other fast heart rhythms, again, those could be exacerbated by a big blast of THC, typically when inhaled. But that's a group we pay special attention to. Smoking toxicity. Smoking of anything is not good for you, whether it's cannabis, cigarettes, or any other plant. And so a lot of the safety issues of cannabis can be minimized or avoided just by not using smoking as a method of administration. Sometimes there's a time and a place for smoking cannabis. Often often the most cost-effective way to use cannabis, but that's a way to minimize risk. Drug interactions come up. They're more common with CBD than with THC, but they're present. It's usually rare that someone cannot use a cannabis medicine because of drug interactions, but it's easy to check. Any online drug interaction checker or a physician's electronic medical record will have it. You can see if there's any potential interactions. This tends to be most prominent with anti-seizure medicines, and there we pay extra attention. But again, something to be aware of. Dependence has never been shown to be a problem amongst medical cannabis users. Tolerance, meaning the medicine stops working as well as it once did, can be an issue. Cannabis tolerance is easy to reset. Usually stop any cannabis for 2 to 3 days, restart at a lower dose, and then the tolerance is resolved. And again, product quality and labeling can be important, especially when you're using that low THC hemp cannabis that doesn't have much regulation. And so you can have some safety issues if things are improperly labeled. I mentioned the side effects of just THC intoxication. Generally, as long as you're using a low dose, you can avoid these completely. So all of these side effects are dose dependent. And as you increase the dose, these side effects can get worse. So some people may have experience earlier in life, college or whatnot, getting anxious or paranoid with too much THC. That's a known side effect. If you keep pushing the dose, you can even get more severe panic or even paranoia. But again, at low dose, it's actually an anti-anxiety compound. So a lot of this is just paying attention to dose. A lot of these side effects can also be therapeutic. So increased appetite might be very therapeutic for someone dealing with nausea, cancer, low appetite. Getting tired and sleepy from THC absolutely might be therapeutic for someone with chronic pain or a variety of other issues who are helping to improve sleep. And again, euphoria is listed as the primary side effect of THC, but euphoria is described as intense pleasure and happiness. So something that absolutely can be therapeutic when used in the right dose. And again, these are common side effects of THC, but even when they occur, these side effects are often far better, far safer profile than many of the pharmaceuticals that we use, where the side effect profile might be kidney damage or death or a host of other things. So just some final conclusions on safety. Again, intentional guided medical cannabis consumption is extremely safe. A lot of the risks are just from smoking, not from cannabis itself. A lot of the risks are really associated with high dose THC intake, which is really easily avoided and unnecessary for most medical patients. There's a few specific predispositions where patients might want to pay extra attention. And then really just remembering cannabis is not a magic bullet. So you can't just immediately stop your current therapy. You need to do that under guidance of your healthcare team and make sure if you're adding cannabis, you're not stopping other therapies that might be necessary. So the last little bit, hopefully just some more practical information to increase the likelihood of being successful if you so choose to add cannabis into your regimen. It really starts with education. By listening to this talk, you've already educated yourself more than 95% of medical doctors in this country. Sadly, we don't educate doctors virtually at all about cannabis. There was a recent study amongst medical residents, so these are doctors who are finishing their training about to go into practice, and 90% said they really had no good knowledge about cannabis. So again, by listening to this talk, you're knowledgeable than more than most people, most healthcare practitioners in this country. So continue to educate yourself as we get more information. And then really have intention. I mentioned this earlier. I wouldn't treat cannabis just like you treat your other pharmaceuticals. You really want to go in with more intention. What are your goals of therapy? What are you really trying to achieve? Then you put that plan into place. You have a starting point. You either pick it yourself, talking with folks at the dispensary, or even ideally getting more guidance from a healthcare professional, doctors, nurses. There's many people who are knowledgeable about cannabis and can give specific guidance. So you implement a regimen, and we use, again, the science and the data that we have to say, well, what's the best place to start? And then you reassess. You assess and say, how is this working? Am I getting my intention? Am I getting my objectives? Am I having side effects? How am I doing? You assess that, and then you make adjustments. That is an effective way really for any therapy, but especially for cannabis. And then you just keep cycling that assessment and adjustment. And over time, you can really find a personalized cannabis regimen that's yours. It's not what's the best regimen to treat rheumatoid arthritis, or what's the best regimen to treat insomnia, or what's the best regimen to treat Parkinson's disease. It's what's the best regimen for me as an individual. And that's the beauty of cannabis. It can become a very personalized therapy if you're willing to go through this assessment and readjustment over time. I mentioned intention is so important, and I think that's huge. And you know, maybe if you're dealing with chronic pain, you know, in the evening, you just want to disconnect and relax and get a good night's sleep and enjoy your evening. So there's products that are better for that. That might be things that have higher THC, where you have a little bit more impairment. But alternatively, if you're at work and driving during the day and you need to focus and deal with complex problems, you don't want any chance of impairment. So there's cannabis options for that. So again, really want people to focus on what's their intention when they're dosing cannabis. And that intention might vary, again, depending on the type of the day or time of the week, or just what's going on in your life. And over time, you can figure out, these are the cannabis products I use for this goal, this intention. And so I think I can't stress that enough. It's so important to have that. What am I trying to achieve with my cannabis product? When you're in the dispensary, especially with ingested oral products, you'll often see things like dose and ratio. And really the take home point here is, this is the dose and ratio of CBD to THC. Usually CBD is listed first, although you definitely want to double check that. The more CBD, the higher the ratio, the less potential for intoxication. So, you know, high CBD might be considered above 5-to-1, but certainly 10, 20, or 30-to-1 is even higher. The higher you go, there's virtually no chance of intoxication. So commonly, again, example, those hemp cannabis CBD products from hemp cannabis, naturally low in THC, are often 30 or 35-to-1. Virtually no chance of intoxication. As that ratio gets closer to 1-to-1, now we have a little more potential for impairment or intoxication, which again, depending on your intention, might be a good thing. But that's a way to start selecting products based on that ratio, based on where your comfort level or whether intoxication might be a therapeutic value. And so if you go into a dispensary, you'll generally see 1-to-1 ratio products, 20-to-1 ratio products, 5-to-1, you know, ideally having a diversity of options. But just know, the higher the ratio, the more CBD, the less likely for any potential impairment. Some final things on when you're implementing a regimen. Always make sleep a priority, especially for those dealing with chronic pain. A good night's sleep is often a challenge, and dosing cannabis in the evening with a sleep-focused product is a great place to start. Usually it's cleared by the morning, so even if you're not using anything during the day, having that good quality pain-free sleep is so valuable. But as we start dosing, we often do best dosing 2 to 4 times a day, getting a consistency. We tend to use higher CBD products during the day, since most people want to stay clear-headed during the day, but we might start increasing the dose of THC in the evening. We might use the same product. Again, it depends. THC, as I said, if we start low, there's virtually no side effects. And generally, if you start with just 1 or 2 milligrams of THC per dose, you're never going to have a problem. And then you can go up slowly by 1 or 2 milligrams every few days, and find that right spot for you. There's that nice, what we call therapeutic window. So if you start low, build up the dose slowly, especially of THC, you're rarely going to run into any side effects or issues there. These are just a range of common dosages of CBD and THC. Some people use absolutely more than this, but I would say 80+% of patients will fit into that level. And so starting at the low end of that range and building up slowly is what tends to work. And as I said, for certain issues, inhaled products might be best, breakthrough pain or nausea, appetite related issues. And finally, as I said, as an integrative doc, I want you to make sure you're thinking beyond cannabis. Do not expect cannabis to just fix your problems. Do not expect any therapy or medication or surgery or procedure to just fix your products. To really treat chronic disease, whether it's chronic pain or any chronic disease, we have to get at the root cause. We have to incorporate changes in lifestyle. So what we eat is so important. Movement and activity, crucial. Finding ways to get quality sleep and relaxation and get out of fight or flight. And then community. We obviously, living through the pandemic, a lot of people have been highly isolated, and studies show that social isolation is more dangerous to your health than even smoking or obesity, things that we talk about all the time. So ideally, cannabis is the first entry point for a lot of patients into kind of this world of integrative medicine. And I find it's this great gateway. Once people incorporate cannabis, they become more open to other integrative tools, both lifestyle and other. And so hopefully this will be exhibited. I'm just going to end these last couple minutes before questions with a case where hopefully some of these things I've talked about will kind of make sense from a patient's perspective. So Beth was one of the first patients I actually saw when I started doing cannabis specific consults several years ago. I repeated her story many times in different talks. One, because she did well, but two, because it's a very common pattern and something that's repeated many times in other patients. So she came in with these were her diagnoses. These are very, very common list of diagnoses that are affecting millions of Americans. And she'd certainly been under care by her practitioners for years, getting treatment, seeing the doctor regularly. But her chief complaint when she came in was, I feel miserable. And so that's not high quality of life. That's not what we're shooting for. And over time, what she'd been offered, well, the things that most people are offered. She was on 7 different medications: pain medicine, sleep medicine, antidepressant medication, blood pressure medicine. And she'd had some injections that worked, but then didn't work, which is a common pattern for most people. Now they were talking about surgery, knee replacement surgery, and she was miserable. But remember, she was getting the standard of care. She was getting all the appropriate therapy, but it wasn't working. And again, that's not surprising to me, because that's what I saw in my practice when I started. That standard of care for a lot of chronic conditions often didn't work. So, is there a better option? Is there another option? She wanted to stay high functioning during the day. She needed to work. So again, a high CBD oil twice during the day. Just a reminder, high CBD is generally at least a 5-to-1 ratio, of CBD to THC, but often that's even higher, 10, 20, 30-to-1 ratio. So again, a high CBD product during the day keeps her clear-headed, not going to have any chance of impairment or intoxication. At night, we switch to a 1-to-1 ratio, so there's more potential to be impairing, not always, depending on the dose. But again, she was able to start at a low dose that was non-intoxicating and build that dose up in the evening until she found the right balance, where maybe there was a little bit of intoxication, but it was that pleasurable experience where she could just enjoy her evening, be more comfortable, cook dinner, be with her partner, watch a movie, read a book, whatever she wanted to do, and just be more comfortable. But again, cannabis is not a magic bullet. Again, I use an integrative approach with anybody. So taught her about an anti-inflammatory diet. for anybody dealing with chronic pain, it's malpractice, in my opinion, that food is not mentioned. I've seen patients reduce their pain by 90% just with changing their diet. That's not necessarily going to be what works for everybody, or not everybody's able to change their diet so aggressively, but incorporating an anti-inflammatory diet is so crucial, and so a huge part of her treatment plan. Taught her some mindfulness activities, because with chronic pain, she's always in fight or flight. So mindfulness and relaxation measures can help her get out of that fight or flight, quiet down that immune response. And then actually got her started with physical therapy. Physical therapy had been kind of thrown into the mix at different times during her years, but really was never made a priority, and certainly not a home exercise program was never made a priority. So got her back going with physical therapy. And in the results, she did well. Her regimen was easy to implement. She figured out the right ratio in the daytime, and she saw immediate benefits in the evening, and titrated to a good dose for her. Her daytime symptoms took a little while, but that having just good sleep and that relaxing evening was a huge benefit for her since she was struggling. Within a month, she was able to stop a few of her medications. Long term, as she felt better, she was able to do more things to herself. She started going to yoga and doing some more outdoor walks. It was easier to do food prep because she was in less pain and feeling better. So it was just easier to incorporate that anti-inflammatory diet. So now we get this positive cycling where she's able to eat better, which then helps her pain, which means she's able to exercise more, which helps her pain more. And you see this cycle in a positive way, able to interact with her friends and her community more. Simply, she's feeling better. She was off pain and sleep medicines, like I said, pretty early. Within 3 months, she was able to taper off her antidepressant and one of her nerve pain medicines, or her fibromyalgia medicines, which is for nerve pain. Over time, with improvement in stress and sleep and even some weight loss, she was able to wean off her blood pressure medicine after about 6 months. And so this was a great outcome. Not everybody has this great result, but this is pretty common. When we quiet down the immune system, when we quiet down an overactive nervous system, we get at the root causes. It's not surprising for someone to have benefit. So finishing up here, a lot of information I've thrown at you. Again, for those on the call this morning, definitely happy to answer any questions that are there. But these are some options just for more help. Project CBD is a website that's just great educational material on all things cannabis. So really well done. You can dive deep into some of the research, but they also have some nice overview articles meant for lay folks. Leaf 411, like I said, is one group which I sit on their advisory board. They're a nonprofit run by nurses where anybody can call and speak to a nurse or have a text chat with a nurse about cannabis questions. They can't diagnose or treat. That's the job of a physician or a physician assistant, but they offer low-cost consultations to help guide people to safe products or just answer any question you have. And then healer.com is a website run by a physician in Maine, really one of the leaders in the world on cannabis education and cannabis care. And his website's filled with a wealth of good information about how to initiate cannabis, how to work with tolerance. He's got handouts and all kinds of things. So 3 outstanding resources for more education. Just remember, define your intention and your goals. Trial and error is okay. Cannabis is extremely safe when used with guidance and starting at a low dose. So as long as you're starting low, even with THC, keep notes, track your responses, make adjustments, you're gonna do fine. And if you need information, use cannabis professionals. There's doctors like myself who are trained in cannabis and can guide folks. Like I said, there's nurses and other cannabis educators out there that help patients. So if you're struggling, there's definitely cannabis professionals that are out there to help you. So I hope that was a value to you. I know it was a lot of information. And like I said, for James and Tim and Hannah who are on the call, feel free to jump in and any questions or things I could clear up for you.
This is Tim. Firstly,
Hi, Tim.
thank you for a wealth of information. I'm on page 5 of notes here. So it's fantastic. I appreciate it. I've been smoking cannabis for 50 years. And, I love it. And I love this new category, this overlapping circle of the intentional cannabis grass users. I still speak with grass because that's what it was when I was a kid.
Yeah.
And I really have found that I take you can see it like this much on my fingernail in a pipe, in a bong, and I am just fine. I accomplish what I want, which is what I call a shift in perspective. So for me, it's spiritual oriented. And so now I go over to the pharmacy. I mean, compared to the old days, trying to get grass and not just able to walk into the store. Oh my God, I cannot believe it. So now the problem is that I'm overwhelmed and the people there do not know how to answer my questions. So I just pulled out this most recent one I'm on. Is I can see now why it's enjoyable. It's 22.26% THCA, virtually 0.29% THC, and 0 CBD, A or G or D. So it's all THC. I got it. But what I don't have is any guidance about choosing one. They have fancy labels. This was called lemon meringue. I got all their fancy names. I have no way to check out one from another. Are there any guidance on, and I seem to be, each distributor or dispenser seems to grow their own. So there's no way to compare one dispenser to another. So I stick with one dispenser and experiment. Is there any way, if my intention is to be an intentional cannabis user, how do I evaluate? How do I choose?
Yeah, it's a great question, and it's a challenge. It's probably even more of a challenge in Colorado, where the focus is not so much on intentional use. It's on just getting as much THC as possible in a lot of the products that are out there. But there's a few ways. I didn't talk about the terms indica, hybrid, or sativa because they're not great terms, but unfortunately, that's still how products are labeled. In general, products that are labeled as indica tend to be more sedating, tend to be more relaxing, calming, and kind of knock people down a little bit. The term couch lock is often used, where if you use enough, you're just kind of knocked out. Now, those are if someone really needs to relax and sleep. Things labeled as an indica might have more value. The flip side of that, products labeled as sativa are more likely to be uplifting, stimulating, energizing, and then things labeled as hybrid are in between. The reason I don't like those terms is because everything is a hybrid, and plants have been bred and rebred and hybridized. That those terms don't really make a lot of sense. They're more a guess on how that product might make someone feel. The best way to really,
I've switched to most recently is the hybrids. Listening to these young people, they're all young people in the dispensers. Chat. It seemed like a combination was, I didn't really want to couch out and I didn't really want to go out skiing. I wanted to kind of like be in the middle. So I went for the hybrid, and it seems like a good mix for me.
And that is true for a lot of people. Really, the best way over time is using your nose. So I mentioned early on that terpenes are one of the main constituents in the cannabis plant, and terpenes provide the flavor and the smell, but they also have physiologic properties, and they kind of direct the effects. So if you think of THC often as the main engine, terpenes are kind of like the wheel. It directs which way to go. So terpenes that are often going to be the reason something acts like an indica or sativa. So something that smells very bright and citrusy and piney, those tend to be uplifting and stimulating terpenes. So something that where you smell it and it feels very bright and stimulating, it's going to act more stimulating. Something that's more earthy and musky tends to be more sedating, or floral tends to be sedating. So you obviously, unfortunately, with COVID, can't smell in the dispensary anymore, But when you come home, you can really smell. And when you find some cannabis flower that you enjoy, like, oh, this really worked well for me, really smell it and try to imprint that smell. And then you can kind of go and say, hey, I want something that, has these properties. In Colorado, unfortunately, we don't test for terpenes. Other states do. Other states, you can go in and say, I want something with a lot of linalool and myrcene, which are two of the more sedating compounds, which are great for sleep and relaxation. Or you could go in and say, I want something with a lot of lemon and citrus, and you can go. So smell is the best way when you're using cannabis flower to kind of predict how it's going to be. And if you smell cannabis flower and doesn't smell good to you, you're not likely to do as well. So those are some options. Again, right now we still have to use these terms indica, sativa, and hybrid to kind of be kind of stimulated, relaxed, or somewhere in the middle. Again, hopefully in time we'll have more labeling where we can really say, here's what's in it, and it can be much more accurate about how someone's going to respond to it. But we have to kind of go off word of mouth and some of these more inaccurate labels, just because that's what the industry is still utilizing at this point.
Yes, yes. I used to be able to smell things. Now everything is sealed. It's a sealed package.
Yeah,
okay.
There's a lot of changes there. But again, you can one thing you can do is some research on terpenes. Like I said, there's lots of information. So Product CBD is probably a great website where they talk about the terpenes, and you can kind of read about them, and you could go in and say, oh, I want something that's a little more citrusy, or I want something that's more earthy or musky. If you're dealing with pain, something that's peppery or spicy tends to be more effective for pain. What we call beta caryophyllene is the terpene that we associate most with pain relief. So there can be some ways to research. You can also rotate through different, what we call bud tenders, the people that work at the dispensaries. Sometimes you actually then will get someone that's pretty knowledgeable and can give you some good guidance there. But like I said, using some of that old-fashioned terminology still we have to go off of now.
Okay. Thank you. Appreciate it.
You bet.
Oh, do you do any of your practice involve people who are intentional cannabis users?
Absolutely. Yeah, and often that may not start that way. Someone comes in for just, I want to treat my pain or my arthritis or whatever, and then after 6 months they've gotten comfortable, and now they decide, hey, I want to explore this spiritual side or this kind of introspective side of cannabis, and they'll come back and talk about that. I would say it's more after they've kind of been a little bit more medically focused for a period of time to treat a specific condition and get comfortable with their medicines or the plant, then they kind of return and want to discuss it more. How can they expand themselves?
Okay, good. So I'll keep you in mind. I can reach you through Stefan. And
through Stefan or that website as well.
I use a triple water thing bong, which keeps down, I think, the impurities in the smoke. So
yeah, I hate to actually burst your bubble on that one. Likely not the case. It cools it. Using a water pipe with various layers will cool the smoke, which has some value. But from an impurity side of thing, that's actually not been shown to be the case. If you're using a small amount, the smoke is probably not going to be a huge problem. Again, at some point with chronic smokers, we often say, it can explore using a dryer vaporizer where you're just vaporizing. You're using a temperature where just the medicine and the chemicals evaporate, but you don't burn any of the plant material. So you just inhale pure vaporized cannabinoids, terpenes, and whatnot without any smoke. So that's often a route we'll explore for regular smokers. But again, if the overall quantity, like you said, is so tiny and you're just taking one puff, that amount of smoke's probably not going to have a significant health impact.
I may want to talk to you because I have had lung cancer twice.
Okay, so maybe a deeper discussion.
I have never smoked, and mine is asbestos and radon and
Yeah,
environmental
no,
stuff.
it's well researched that cannabis smoking, even daily heavy smoking, does not contribute to lung cancer, but it can contribute to cough and bronchitis and congestion and things like that. So yeah, exploring a drier vaporizer might be something you'd be interested in.
Thank you very much.
Absolutely.
Hi, Dr. Gordon. This is Hannah Shanes. I had a couple questions for you.
Absolutely.
The first of which is just recently at a dispensary, I had somebody mention that CBD does accumulate in the liver. So prospectively, with high enough doses, there could be some liver toxicity. Is there any validity to that? Is it not a concern just given clinical usage, or totally invalid, which is possible?
Yeah, I don't. There's definitely an association with CBD in the liver. I don't know if the term accumulate in the liver is quite accurate, but so in the prescription CBD study, so this is a medicine called Epidiolex, which is approved in the United States for a couple of pediatric seizure disorders. This is 100% pure CBD, just what we call CBD isolate. And in those studies, depending on the size of the kid, but in adults, often a 500, 1,000, 1,500 milligrams of CBD is being used, even in some of the studies, even 2,000, 2,500 milligrams. At those dosages of pure CBD, a decent minority of patients got what we call elevation of their liver enzymes. So liver irritation, inflammation. I off the top of my head, I think at those high dosages, maybe 20, even 25% of patients had some liver irritation. And then after stopping the medicine, that quickly resolved. There was no liver failure or liver, end stage liver disease, anything like that. So at high dosages, like I said, often in the many hundred or even few thousand milligrams, CBD can be a little bit of a liver irritant, the same as maybe like a cholesterol medicine, a statin might be, or other antifungal medicines. And so usually if someone needs those high dosages, you just monitor liver tests, and if numbers get too high, you stop the medicine. But that's really in those high dosages of CBD isolate. If I have a patient using 200, 300, 400, 500 milligrams of CBD, I've not seen liver elevations. Often maybe I'll check it after 6 months or 3 months. And some of that is typically I'm always using CBD, not as an isolate, but with other cannabinoids. And I think that tends to, again, provide this entourage or buffering effect. And then the reality is most patients, I would say, are more in the tens up to maybe 100 or 200 milligrams a day of CBD when, again, they're using these full spectrum products where I just don't have concern about liver issues. So short answer, or actually that's really, I should say long answer, is yes, CBD can cause liver toxicity when used in high dose, but at the dosages we're commonly using for most patients, especially with other cannabinoids, rarely or really not an issue at all.
Excellent, thank you. It does make sense with the pharmaceutical version. We start to see toxicities. And then my next question might totally be a divergence from the topic, but I'm kind of curious about your take on whether there's any synergistic activity across to the, let's say, decriminalized psilocybin, if we're starting to see research across, and the degree to which there are synergies between medical use of cannabis and medical use of psilocybin.
Yeah, they do get lumped together often just because they're substances that have been, well, still are Schedule I substances and have been part of this prohibition era. They certainly act very differently in the body. Traditional psychedelics like LSD or psilocybin and cannabis, again, act, like I said, very differently. Where there's overlap is in a few areas. First, like I said, they've both been part of this mass prohibition over many years, and have had to go through fighting for access. Interesting, there's what I would say better hard research or randomized controlled trial research on things like psilocybin, MDMA, or LSD, because those are all single isolated molecules. It's very easy to study a single molecule, whereas I say with cannabis, when you say I'm going to do a study, am I using THC, CBD, a combination? What about all those other cannabinoids? Am I smoking? Am I eating? Whereas psilocybin is really easy to say you're using 100 micrograms of psilocybin in a randomized study. So there's actually better randomized controlled research for things like psilocybin, LSD, MDMA, and you'll likely see in the next 1 to 2 years FDA approved therapies in that realm. So they're probably a little further in terms of being universally accepted for specific conditions because it's just easier to study. The other overlap is again more to this kind of intentional and expansion purposes. Even though they act differently, both are psychoactive, or at least THC containing cannabis is psychoactive, where you can get kind of a mind expansion, see things in a different perspective. Not going to get the hallucinogenic experiences that you'll get with traditional psychedelics, but still can lead to some change in perception and thinking. So there's some overlap there. But again, from a pharmacologic standpoint, they're working very differently. And how we'll see, I guess I hope we don't actually see the psychedelic compounds burgeon into this mass production retail store where people have kind of unlimited access without guidance or education, where I think that the harms are more likely to be manifested. So hopefully as psychedelics do undergo some type of decriminalization or legalization, it's with a little more, I don't know what the right term is, guidance by people who know a lot about the medicines, not just kind of a free-for-all, I guess I would say.
That's awesome. Very interesting. Thank you very much.
You bet.
Okay, this is Stefan. Thank you, Dr. Gordon. It was fascinating, this talk, and it confirms our view here in the clinic, and certainly also my personal view, that education is the key to good healthcare. So unless there are any additional questions, I'd like to thank you again, Dr. Gordon. And this is recorded, this talk, so it will be sent out to all who are on our email list. And that will happen within a week or so. So everybody have a good week. Dr. Gordon, thank you so much. If there's anything else you'd like to say, go for it. If not, then I'll end this recording and this presentation for today.
No, just thank you to all those here in person, all those listening after the fact, and to you and your clinic for providing these great educational opportunities, so we can get that good education and give people the best chance of success.
Okay, thank you. Have a good week, everyone.
All right.
Okay.
Bye-bye.
Bye-bye.